All right, let us continue. Indicate if you can hear me, raise your hand. All right, that's good enough. That is good enough. Lower those hands for me now. Lower the hands. Thank you. All right, so next chapter is chapter 6, the human body, which really is anatomy and physiology. So you need to have a strong knowledge and understanding of the anatomy and physiology of the body. So you need to be familiar with the structures in the various systems of the body and how these structures function. Now, the structure is general knowledge. You have to learn that. That's general knowledge. The function requires understanding. So you learn the structures, but you need to have an understanding of how the structures function. In other words, you cannot SWOT function. You can SWOT structure, but you cannot SWOT function. You have to understand function. Now, we will be covering all the systems. However, there are 4 key systems that you need to grasp very early. So there are 4 systems that you need to know and know them very well. The musculoskeletal system, the respiratory system, the cardiovascular system, and the nervous system. These are 4 systems that you need to grasp early. You will need to know the others, but not as deeply as the 4 I just mentioned. And your exam on Monday will focus heavily on the 4 systems that I just mentioned: musculoskeletal, respiratory, cardiovascular, nervous. Now, let's get into it. Introduction. A working knowledge of anatomy is important, and anatomy is structure. Knowledge of anatomy helps to communicate correct information. So if we're going to be assessing a patient to provide treatment, then we need to know the patient's system functions, because when they start to have issues, it is abnormal functions of a system. So if you don't know how that particular system normally functions, then you can't recognize abnormal functions. It's that simple. So knowledge of anatomy helps to communicate correct information to other medical professionals and to others who may not understand medical terms. The focus of this chapter will be mostly on topographic anatomy. So it's going to be heavily geared towards topographic or surface anatomy and not necessarily microscopic anatomy. Superficial landmarks serve as guides to structures that lie beneath. Topographic anatomy applies to a body in the anatomic position. Patient stands facing you, arms at the side, palms forward. I've already talked about this position, and I think there's a picture of it in this particular presentation. Now, planes of the body. You need to be familiar with the planes of the body. These are imaginary lines that divide the body, and there are 3 main areas that you need to be familiar with at the EMT level. You have the frontal or coronal plane, which that divides the body into an anterior and posterior portion. You have the transverse or axial plane, which divides the body into a top and bottom portion, or superior and inferior portion. Then you have the sagittal, which is a lateral plane, which simply divides the body into left and right. And then you have the mid-sagittal, which divides the body into equal halves. All right, now if you look on this particular diagram, where the sagittal plane is actually where you would have your mid-sagittal line, right? So let me draw where so this is where so the line that I just put in the diagram represents the actual sagittal plane. So the sagittal plane divides the body into left and right, but it's not equal. The mid-sagittal or midline divides the body into left and right halves. So it's equal. Make sure you know the difference between sagittal and mid-sagittal. The frontal or coronal plane divides the body into anterior and posterior. Transverse or axial plane cuts the body into a superior and inferior portion. Right? So these are the planes that you need to be familiar with. Go ahead, Mr. Moran.
Can you repeat again, sir, about the mid-sagittal?
Okay. All right, so the mid-sagittal or midline cuts the body into left and right halves. So it's always going to cut the body into equal halves. The sagittal or lateral plane cuts the body into left and right. It's not equal. That's the difference.
Thank you, sir. Thank you.
Cool. All right, now let's look at the first system, skeletal system, anatomy. So the skeleton gives us our recognizable human form, and it consists of 206 bones. It protects vital internal organs. It is comprised of bones, ligaments, and ligaments connect bone to bone, and they provide stability within joints. It is comprised of tendons. Tendons connect muscle to bone, and when the muscle contract, we get coordinated movement or controlled movement of the limb or an area of the body. Cartilage is the protective covering over the bone ends to prevent friction. So it prevents the bone ends from rubbing together. Now, the skeletal system is divided into the axial skeleton and the appendicular skeleton. Now, how I look at it, or an easy way for me to remember it, is the axial skeleton is the centerpiece of the skeletal system. So the centerpiece is the skull, the spinal column, and the thorax. That's the center portion of the skeleton. That's the axial. The appendicular skeleton is the attachment for the arms and legs. So the appendicular skeleton is the attachment for the upper extremities and the lower extremities. but we are going to look at the axial skeleton first. Now, the skull is divided into the cranium. So you have the cranium, and then you have the face. The cranium is made up of 4 bones that you need to be familiar with. You have the frontal bone, parietal bone, occipital bone, and the temporal bone. So these are 4 bones that you definitely need to be familiar with, because the brain have similar lobes. So the brain have frontal lobe, parietal lobe, temporal, and occipital. And basically everything that is on this slide, you need to be familiar with, right? So the 4 bones of the cranium, your upper jaw, the upper jaw, which is the maxillae, the lower jaw, which is the mandible, the zygomatic bones, which are the cheekbones. Now, the diagram to the right is giving us an inferior view, and you can see the foramen magnum, that opening. So let me use my pointer. This opening right here is the foramen magnum, and this is where the spinal cord exits the skull and runs down the spinal column. Foramen magnum. No, so that's the skull. Then you have the spinal column, which is composed of 33 bones or vertebrae. 1 vertebra, multiple vertebrae. It is divided into 5 sections. So there are 7 cervical vertebrae, 12 thoracic, 5 lumbar vertebrae, 5 sacral or sacrum, if it's because it's fused, and 4 coccygeal, which are fused, which forms the coccyx. Now, the purpose of the spinal column is to protect the spinal cord. So within the spinal column, the spinal cord is located. And if you look at the diagram, you can see where the nerves start to branch out from the spinal column to the various areas of the body. Now, if I ask the question, so if I asked you the question to list the 5 sections of the spinal column in ascending order, where would you start from? So if you know the answer to that question, go ahead. Okay, I see an answer from Ms. Kerr. All right, good, good. We would start from the inferior end. Good. And if we're going in descending, it would be from the top down. Excellent. All right, now the thorax. The thorax is formed by 12 thoracic vertebrae and 12 pairs of ribs. The thoracic cavity, which is a space within the chest region, contains the heart, it contains the lungs, the esophagus, and great vessels. Now, if we look at this diagram, we will see some areas that we definitely need to be familiar with. So you have the sternal notch, which is an important landmark if we need to determine if the trachea is centered in a trauma patient. You have the top portion of the sternum. So the sternum is divided into the manubrium, which is the top or superior portion, the body is the mid portion, and the xiphoid or xiphoid process, which is the tip, which can be broken off when doing CPR if hand position is not good. Now, there are 12 pairs of ribs, but let's go down. So from 1, 2, 3, 4, 5, 6, 7. So the first 7 pairs of ribs are directly attached to the sternum. So they are referred to as the true ribs. So the first 7 are directly attached to the sternum. So they are referred to as the true ribs. Why is this information important? Why is Mr. Rufus giving all of this information? This is too much. It is important to know this because if the number 7, sorry, if 1 to 7 is attached directly to the sternum, it means that if a fracture occurs in that area, significant force has been applied, right? Because it's directly attached to the sternum. Go ahead, Mr. Washington. Mr. Washington, go ahead.
Yes, sir. I'm looking at it, sir, with the explanation. I get a conclusion from it. It's like it's showing that it protects the heart and the lungs from 1 to 7 is covered the heart and to the lungs.
Right, you can look at it that way, but just keep in mind that if a fracture occurs there,
yes, sir,
depending on whether it's left or right, it can damage the heart and it can damage the lungs.
Yes, sir.
Right?
Yeah.
But it takes significant force to crack that portion of the rib.
Okay, sir.
All right. Now, pairs 8, 9, and 10. So from 8 to 10, right? 8 to 10 are not directly attached to the sternum. They are attached to cartilage, which connects to the sternum, right? So 8 to 10 are referred to as the false ribs because they are not directly attached to the sternum. It is the lower rib cage. So if you start to think about lower rib cage, if there's damage in that area, especially the upper portion of the 8 to 9, then we should be thinking about complications to abdominal structures and not only the chest. So 8 to 10 are the false ribs. Now, not seeing it so clear on this diagram, but pairs 11 and 12. So if you look at 11 and 12, you will realize that they only have posterior attachment. So there is no anterior attachment for the final pairs. The final 2 pairs of ribs, they only attach posteriorly. And they are referred to as the floating ribs. So that's what we call the floating ribs. And that's your axial skeleton. So the axial skeleton is comprised of the skull, the spinal column, and the thorax, right? The skull protects the brain, the spinal column protects the spinal cord, the thorax or rib cage protects the heart, lungs, major blood vessels, and other important structures located in that region. All right, now let's look at the appendicular skeleton. The appendicular skeleton. So we have looked at the centerpiece. Let's look at the connection for the upper extremities and the lower extremities. So the appendicular skeleton consists of the arms, legs, and their connection points and the pelvis. So in essence, this is the shoulder girdle and the pelvic girdle. The shoulder girdle is the connection for the upper extremities. The pelvic girdle is the connection for the lower extremities. So it includes the joints, the upper extremities, the pelvis, the lower extremities. Now, joints. There are many joints in the body. There's a lot of joints, and you're not required to know every single joint in the body based on the requirements for this course. However, you need to be familiar that regardless of the amount of joints that are found in the body, they fall into 3 categories. So regardless of the amount of joints located in the body, they fall into 3 categories. So it's a joint that has free range of motion. So it has free range of motion. An example of that would be the shoulder joint, which has free range, or it's a joint that has limited motion, which is a hinge joint. Example, the elbow joint is a hinge joint, or it's a joint that has no motion, right? So there is no motion in that joint, like a fibrous joint. The joints found in the skull and the pubic symphysis, which is a joint in the pelvis, that's a fibrous joint, it doesn't move. So the joints fall in 3 categories: free movement, limited movement, no movement. Now, what is important to take away from this is that the more free range a joint has, the easier it can be injured. All right, let me back up a bit. Yes, the wrist is a ball and socket. All right, now the upper extremities. The upper extremity extends from the shoulder girdle to the fingertips. It is composed of arms. So you have the arm, right? Then you have the forearms, the hands, and the fingers. Now, the shoulder girdle consists of 3 major bones that you need to be familiar with. And these 3 major bones are the clavicle or collarbone, the scapula or shoulder blade, which is posterior, and the humerus, which is the upper arm or funny bone, that's the humerus. I have specific joints within that area: the sternoclavicular joint, acromioclavicular joint, and the glenohumeral shoulder joint. So that's the shoulder girdle. The arm, this is the humerus, is the supporting bone. The forearm consists of 2 long bones, the radius and ulna. The radius is lateral, so it's in line with the thumb. The ulna is on the inside of the forearm, so that's in line with the pinky or small finger, so it would be more medial. Now let's look at the wrist and hand. Ball and socket joint for the wrist, The principal bones within this area are the carpals, which are the bones that form the wrist area. Then you have the metacarpals, which make up the palm area or hand. And then you have the phalanges, which are the fingers. Now let's look at the pelvis and the pelvic girdle. The pelvis is a closed bony ring consisting of 3 bones. The sacrum, 2 pelvic bones, the sacrum and 2 pelvic bones. Each pelvic bone is formed by a fusion of the ilium, the ischium, and the pubis. So let's look at that diagram. So if we look at the diagram, we can see where the ilium is, and that's the wings of the pelvic wing. And then the ischium is more inferior, and you have the pubic symphysis, which is a joint, the ischial tuberosity is the buttocks bone, an important landmark if we are going to use a traction splint. And we have major veins and arteries that run into this area. So you actually have the descending aorta and inferior vena cava, which we'll talk more about when we cover cardiovascular system. So posteriorly, you have the ilium, ischium, and pubis bones, which are joined by the sacrum. Anteriorly, the pubic symphysis is where the right and left pubis are joined. Now, main parts of the lower extremities include the thigh, the leg, and the foot. The thigh bone is the femur, which is the largest bone in the body. So it's the largest and longest bone in the body. It connects into the acetabulum, which is the pelvic girdle, by a ball and socket joint. And you have the greater and lesser trochanter, which is really the inner and outer portion, right, where major muscles of the thigh connect to the femur. The knee connects the upper leg to the lower leg, and the kneecap is the patella. The lower leg consists of the shin bone, which is the tibia, right? The tibia is the shin bone, and that's the one that is more anterior. So that's the one that is more anterior. The fibula is more lateral. So it's more on the lateral side of the leg, the outer side of the leg. The ankle joint is a hinge joint, and it allows flexion and extension of the foot. The foot contains 7 tarsal bones, right? So, and that would be the bones that form the ankle area. The metatarsals form the foot portion, and then the toes are referred to as phalanges, just like the fingers. And that would be the structure of the skeletal system. And everything that was covered, you need to learn. Go ahead, Mr. Fisher.
I hope my question doesn't sound crazy, but are the bones in the foot made from some material that is slightly different from the other bones, which makes that part of the body so prone to injury? You know, bearing in mind that it carries most of the weight or whatever, but hitting your heel or something, the ankle tends to give so easily. So I was checking if those bones are made from any material that's different.
Not to my knowledge, I'm not aware of that. Right? No, anywhere you have joints in your body, you're gonna have weakness there. So no joint in the body is strong. Every joint in the body is weak. It's one of the weakest areas of the skeletal system. Right? It's very difficult to strengthen joints. But if there is good blood supply, good nutrients in the area, then they will have a little more durability. But joints are generally weak. Yes, go ahead, Mr. Roberts.
Morning again, sir. I can see here, there are three different kinds of joints. Uh, allow rotation would be ball and socket. Limited movement would be a hinge joint. The one with no movement, is there a bigger heading
Example,
for it?
it's a fibrous joint. It's not something that I needed to know
Fibrous joint.
at this level. Just know that you have joints with limited movement,
Oh,
because
okay.
there's another way of classifying it, but I don't want to go too deep into that. So just keep it simple.
Okay, sir.
Yes, Mr. Doheny, go ahead.
Oh, I wanted to say something based on the previous person's question. Some some bones in the body will tend to be slightly more dense than others. Like example, the metatarsals is more dense than the like the femur or so forth, because more pressure is on that bone. So it is the same material, but it can be a slightly bit more dense. So basically dense meaning you have more of that same material compacted in that area.
All right, thanks, Mr. Doyenne.
All right. Any other questions before moving to the physiology? All right. So let's go into the physiology. Now, the skeletal system has multiple functions. It gives the body its shape, it protects fragile organs, and it allows for movement, it stores calcium, and it creates blood cells in the bone marrow. So that's the main functions of the skeletal system. Gives the body its shape, protection, allow movement, stores calcium, which is very essential, not just to bone strength, but also to how cells create electrical current, to contract. All right. Now, the musculoskeletal system, quite a large amount of muscles in the body. We have over 600 muscles in the body. Musculoskeletal system provides form, upright posture, movement, and protection of vital internal organs. Now, we don't need to know all 640 muscles, but we need to know the three categories that they fall in. So there are three categories that the muscles will fall in, types of muscles. So you have the skeletal, which is voluntary muscle, skeletal muscle, voluntary and striated. You have the smooth muscles, which are found within the intestines and the walls of the blood vessels. And you have the cardiac muscle, which is the heart, myocardium. Now, on this diagram, and you may have to zoom in on the diagram on your end, because if I zoom in on it, you won't be able to see it. So you have to use that feature on your end. But the muscles on this particular slide, you would need to be familiar with. Not all of them, but definitely the ones that are used for injection. Deltoid, the muscles in the thigh, and the gluteus maximus, yeah, the muscles in the buttocks. But we'll go more into that when we start to focus on skills, medication administration. Right, now musculoskeletal system physiology. The actual physiology of the muscles and how they work is very complicated, but we're not going to get very technical with that, right? We're going to keep it simple. Contraction and relaxation of a system make it possible to move and manipulate the environment, right? So muscles work together. So they work as synergists and they work as antagonists. So an example, the bicep, when we flex the forearm, the bicep muscle contracts, the tricep relax. So they are working against each other. That's antagonistic function. However, these two muscle groups must work together to flex and extend the forearm. So they work as synergists and antagonists. And a byproduct of normal muscle contraction is heat production. A byproduct, so if it's normal muscle contraction, the body produces heat. If it is abnormal muscle contraction where enough oxygen or nutrients is not available, then we get lactic acid building up, and that can alter the pH, which can damage cells within the body. Now, apart from coordinated movement and heat, generating heat, the muscles protect structures underneath them. And that would be the musculoskeletal system. And we are going to pause again